My name is Chris Ostrowski. I'm a primary care sports medicine physician at Maine General Sports Medicine and Orthopedics. My original training was in family medicine. I started off at our family medicine residency program here in Augusta, Maine Dartmouth Family Medicine Residency. After that, I was in the community for about 5 years, came back to teach at the residency, and then as part of that, went and completed my primary care sports medicine fellowship. And that's been my primary role for the last 17 years. Primary care sports medicine is a very broad field encompassing a lot of different sort of subspecialties. So we do non-operative orthopedics. We do a lot of ultrasound procedures, both diagnostic and injection. We also do things that are sometimes not so much seen as part of our field, such as cardiac care in the athlete, pulmonary care in the athlete, and of course we see a lot of concussions in our athletes. We provide non-operative orthopedics, so things like fracture care that does not require intervention such as operations or setting of fractures. We do a lot of different injections. In fact, our orthopedic colleagues refer to us because we also have the ability to do them under ultrasound guidance. Ultrasound guidance is great because it allows you to see exactly where you're putting your needle, plus a lot of patients describe it as being less painful. We also offer another procedure called cryoneurolysis, which essentially is something that we do where we freeze the nerves about a given structure, and that helps relieve pain, both from the perspective of if you have arthritis and that pain, as well as prior to having surgeries such as a total knee replacement. We see athletes that have exercise-induced bronchoconstriction. That's something that's very similar to asthma. So we have a wide array of services that we offer that may not necessarily be something that most people associate with sports medicine. I love seeing patients. I love interacting with patients. That's why I do what I do. But I try to meet you where you are and then get you to where you need to be. I've never thought of myself as the primary healer. I am helping you get to that point where you get back to doing what you want to do, whether you are the occasional professional athlete we see, straight to the weekend warrior that is out there because they have such a busy life during the week that the only time they can do things is on weekends. We see the amateur athlete who is just as important to us as the professional golfer who wants to get back out there tomorrow to play a round of 18. I think what sets Maine General apart from our competitors is the ready ease with which we can get you in to a highly competent care team of providers that is closely affiliated with all of our colleagues in physical therapy, speech, athletic training, occupational therapy, our surgical teams, our diagnostic teams. All of these things happen in our institution in a quick and readily available fashion. And I think that's really what sets us apart across the state. I think the thing that I am most proud of establishing, some might say it's developing a primary care sports medicine fellowship. However, that did not happen overnight. When I first came back from my fellowship 17 years ago, I think the refrain was, well, we hope we have enough patients for a half day for you in the office. We now have 5 full-time primary care sports medicine physicians. We have 2 outstanding sports medicine trained surgeons. We have support staff that surround them. We have, through the remainder of our Maine General Sports Medicine partners, developed an entire program that has now basically infiltrated the entire center part of the state. And this is something that is not only unique in Maine, but it's unique in the Northeast.